Garlic isn't and hasn't just been used for cooking. In fact, garlic has been used for medicinal purposes for thousands of years. Garlic has been found in Egyptian pyramids and ancient Greek temples. There are biblical references to garlic in ancient medical texts from Egypt, Greece, Rome, China, and India, each prescribed medical applications for garlic. After viewing this presentation, you should have a better understanding of the medicinal properties garlic offers. Garlic comes in many forms. You can buy whole cloves, freeze-dried, garlic oil, garlic extracts, and dried garlic. To use garlic topically, you can use any of these forms, but usually people use garlic oil. Among many ailments you can see here on the slide, you can use garlic topically for patchy hair loss, athlete's foot, and other fungal infections. As you can see, there is a long list of ailments people attempt to cure taking garlic supplements, so I'll only mention a few. Garlic can be purchased as capsules and can be used for lowering cholesterol, blood pressure, and maintaining heart health. People also take garlic supplements to fight common colds and sinus infections. People have also used garlic intravaginally to cure yeast infections, since garlic has some antifungal properties. There have even been studies done using garlic extract intravenously. A common use of garlic IV is to help with chest pain. As mentioned before, garlic comes in many forms and can be used for a wide variety of illnesses. More research needs to be done to determine its efficacy, but regardless, it is still very popular and widely used.
Some of the major drug interactions with garlic include the drugs isoniazid and saquinavir. For saquinavir, garlic that contains allicin may decrease the area under the curve and bioavailability of saquinavir. Maximum concentrations may be decreased by as much as 54%. For isoniazid, research suggests that an aqueous extract of garlic can reduce isoniazid levels by about 65%. Garlic reduces the maximum concentration and area under the curve, but does not seem to affect the half-life. This suggests that garlic extract might inhibit isoniazid absorption across the intestinal mucosa.
Moderate drug interactions include anticoagulants, antihypertensives, and also contraceptives. Raw garlic can have antiplatelet qualities that can increase the INR and also increase risk of bleeding if taken with warfarin. Garlic also has blood pressure lowering effects. Combining garlic with other blood pressure agents may cause additive hypertensive effects. Garlic's interference with the metabolism of contraceptive drugs vary. Some garlic preparations contain allicin that might decrease effectiveness of contraceptive drugs by increasing the activity of the cytochrome P450 3A4 isoenzyme. However, other extracts containing allicin and allinase may not affect activity of CYP3A4.
As mentioned before, people use garlic for many different reasons, ranging from athlete's foot to improving cardiovascular health. While there are limitations, some studies have shown that the active ingredient in garlic, allicin, helps improve factors associated with cardiovascular health, such as blood clotting and hyperlipidemia, for example. Therefore, we focused on the potential benefits on cardiovascular health, specifically surrounding hypertension and hypercholesterolemia. One possible health benefit of garlic supplementation is reducing blood pressure associated with hypertension. A study by Steiner and others showed that when men with moderately high cholesterol consumed 7.2 grams of aged garlic for 6 months, their blood pressure was lowered. Although an older study, it does allude to potential benefits for lowering blood pressure. In addition, a review of 20 trials with 970 participants by Reed showed that garlic supplementation may somewhat help to reduce systolic and diastolic blood pressure in hypertensive adults.
Another possible health benefit of taking garlic supplements would be to reduce total serum and LDL cholesterol, which are factors that contribute to atherosclerosis. A meta-analysis performed by Reed found that garlic supplementation led to an 8% reduction in serum cholesterol. This reduction in serum cholesterol is also associated with a 38% risk reduction in coronary events by the age of 50. Cholesterol is important for normal body functions, such as cell signaling and making steroid hormones and vitamin D. Statins often interfere with the cholesterol pathway, which could be detrimental for patients. Therefore, garlic could be a good alternative for statins. Several animal studies have also verified the anti-hyperlipidemic properties of garlic. Son et al. Found that high-pressured, high-density garlic was able to lower triglyceride, LDL, and total cholesterol levels.
The consumption of garlic has some potential risks to be aware of. Evidence has been gathered that garlic has antiplatelet activity. Like other antiplatelet drugs, it is recommended that garlic is not consumed at least 7 days prior to surgery. It can increase the risk of bleeding, especially in individuals undergoing surgery. As noted in the study previously, the reduction of blood pressure due to garlic has been found in rare cases to be potentially harmful for individuals with hypotension. It is not recommended that individuals with low blood pressure consume garlic for the risk of lowering blood pressure even further.
Another potential risk with garlic supplementation is when using garlic on the skin. Several studies have shown evidence of contact dermatitis after use of garlic topically. More severe skin lesions have been seen as well, although they are less common. One rare side effect is gastrointestinal distress, such as nausea or cramping. This has not been shown to occur often, but it is a potential side effect. Lastly, garlic supplementation can cause body odor and bad breath. Even though this is not a health risk, patients should still be informed that it could occur.
There are many ways that patients utilize garlic to try to improve their health conditions and improve their symptoms. Patients and providers use garlic supplements topically, orally, intravaginally, and intravenously. Most commonly, garlic is used to treat hypertension, hypercholesteremia, athlete's foot, insect bites, and ringworm. Studies have shown that garlic does have potential benefits in lowering blood pressure as well as total and LDL cholesterol. This overall can lower the risk of heart disease in patients. There are potential risks with garlic that include increased risk in bleeding, severe hypotension, gastrointestinal stress, and irritation of skin with raw garlic. There are additional adverse effects, such as increased body odor and bad breath. Currently, there are no known food interactions, and the most notable medication interactions include isoniazid, saquinavir, anticoagulants such as warfarin, birth control, and antihypertensive drugs.